Aloha and welcome to Insights on PBS Hawaii. I'm Daryl Huff. People around the world are living longer. According to the CDC, Hawaii has the highest average life expectancy among men and women in the nation at just under 81 years. The cost of living here is already through the roof, and if you're a senior, that's almost impossible to do on a fixed budget. But that's not the only issue facing our kupuna. With older adults representing nearly a quarter of the state population, there's a dire need for more long-term care options. Tonight we're asking our panel if enough is being invested towards our kupuna and how can we help them. We look forward to your participation in tonight's show. You can email or call in your questions, and you'll find a live stream of this program at pbshawaii.org and the PBS Hawaii YouTube page. Now to our guest. Caroline Katarau is the director of the state's Executive Office on Aging. The agency is in charge of coordinating a statewide system of elder care and caregiver support services in Hawaii. Kelly Lopez is the state director of AARP Hawaii, the American Association of Retired Persons. It's a nonprofit organization that focuses on issues that affect people age 50 and over. Kathleen Wyatt is a registered nurse and a licensed nursing home administrator. She's the president of the Hawaii Family Caregiver Coalition and runs Hale Hau'oli Hawaii, a nonprofit that provides services to the elderly and their caregivers. And Brooks Bear is a former broadcaster and communications professional who, like countless people in Hawaii, struggled to care for and find the appropriate care for his aging mother, which his family could afford. And let's start with you, Brooks. What is it that you think people need to know about the process that you went through?
I think they need to know that it would be great for them to plan. I think they need to know that they should tap into the wonderful resources that are available, because growing old isn't something that happens overnight. It happens gradually. We do have a chance to plan for it. And despite the fact that that's the case, it kind of creeps up on you. And it's there, and once it gets there, there's so much to do. It's overwhelming, it's expensive, it's really time-consuming, but it's what you care about so much, and so you make the sacrifices you have to get that done. But prep for it financially and know what those resources are.
Tell me a little bit about what you went through in terms of trying to find the appropriate place for your mom.
Yeah, so Daryl, first of all, I got to say about my mom, she was an incredibly woman, incredibly smart, incredibly strong, incredibly independent. And so, she always wanted to be independent, lean on family when she had to, but the idea of having strangers care for her was not something she really embraced, I don't think. And so the older she got, and as things like memory and whatnot started to slip, she leaned on family more and more. And I was the only son here in the islands. I have a sister who lives on the mainland who was very supportive whenever she could be, and would travel out here and spend time with us and care for my mom. And I have a wife who obviously did everything she could. But one thing about people who grow old, I think you guys know, that they will rely on and trust the people they're most familiar with. And, she'd known me since day one, and so she leaned on me a lot.
Yeah. Kathleen Wyatt, how does Brooks' story ring with you? I mean, how common is what he went through?
Trying to find resources, it's very common. And a lot of us do caregiver workshops, and we do presentations trying to get people to know what resources are out there for you. But I don't know why we can't get to more people. I don't have an answer for that, because a lot of people just don't know what's out there.
Kelly Lopez from AARP, I mean, why is there this big gap in what people know and don't seem to know? I'm astounded. Every time I talk to somebody about caregiving issues, it comes up over and over again. Oh, we didn't know this, we didn't know that.
Absolutely, and it's partly what Brooks mentioned, which is it creeps up on people, right? So it's something that they just really don't think about, and all of a sudden, you go from a parent or a spouse who's doing well, and boom, they need assistance right away. So part of that just is the anxiety that comes into that, and a little bit of panic at times. And I think folks just then begin to use their own personal network rather than reaching out. I'm 100% with you. I think there is more that needs to be done to make people aware of the fact that there are actually quite a bit of resources. Is there enough? No. But a good part of that is what Brooks folks did, which is oftentimes being able to lean on family and have your family members help care for. If you've got folks that can do that, my mother, who was passed when she was 85, but for about 5 years, my entire family, we all took turns taking care of mom because she needed 24/7.
Sounds like a nice, healthy family too.
Right.
Which is,
Well, but not everybody has that, or you know, some kupuna are here on their own, and their children are in the mainland. So there's just a broad range. You know, you talked about how people knowing about what's out there. One, and Caroline can talk to this, which is services that actually each of the neighbor islands have. But another is a program called CareSift. There may be others like that, but we do workshops, and they've participated with us, where it lets people know there's a range of services.
I can hear Brooks. I can feel Brooks nodding away at the term that you found. You can find an agency that can help you.
Yeah, I felt responsible for the fact that I didn't know enough. How is that possible that I didn't know enough? And so, we did a lot of the research and legwork ourselves. And by the time I found the appropriate place to place mom, I mean, we started with in-home care for her, and we brought people in. If you think that's expensive, wait till you get to the next steps, which are residential care, and even residential care and supplementing, bringing people into the residential care. It really gets expensive. But by the time I figured it all out, I stumbled upon CareSift, and I wish I'd known them earlier on in the process.
Caroline Cutteroff from the Office of Elderly Affairs, right?
Executive Office on
Executive
Aging.
Office of Aging. Okay. What is happening to address this gap? Is this a job for government?
Well, that's what the Executive Office on Aging does. Our mission is to optimize the health and safety of our older adults, and we do that through programs, policy development, coordination of services and supports, and the development of ways of helping older adults. And I'm listening to the stories and everything that everyone's been talking about, and it resonates, because that's something that, and one of my goals over the next few years is really, how do we elevate that education piece and that knowledge piece, because that's where it starts. And like Brooke said, it comes up on you, it creeps up on you. And if you're not prepared, we have a lot of calls that come to our office, to our area agencies on aging, and it's from people that have waited too long and now they're in crisis. And how do we mitigate that to make sure that they have that education and they can prepare for the future?
So a caller, I'm already getting calls. We're going to get a lot of calls, and I want to help as many people as we can with these questions. Melissa asks, is there a one-stop shop for us to go to get information? How do we find out what we need?
Yeah, I'll take that
Kathleen?
one.
Oh, go ahead.
So from the
Caroline?
public services and supports, they can call the Aging and Disability Resource Center, and that number is 808-643-2372. The Aging and Disability Resource Center it's basically, how may I help you? And then we listen to what their story is.
I want to hear that again. Say the number again.
Okay.
And then remind me that at the end of the show, you're going to say that number again.
I will. Okay.
So go ahead. Say who that is, what the number is, and then we'll repeat it again.
Okay,
Sorry,
so
I didn't mean to interrupt.
That's okay. No, it's okay.
That's what Melissa needs. I think.
Okay, so it's the Aging and Disability Resource Center. We have sites on all our islands, and they can call there. The number is 808-643-2372. And they will help to guide you and ask you questions. We ask them, do you have time to answer some questions? We find out what are their needs, what are their preferences, are they in need now? Are they planning for the future? And we really try to help them to navigate what their needs are, and try to address it either with publicly funded services and supports, or they have the means to pay for services. We'll help to direct them to various resources in the community.
Kathleen, your thoughts on that. And also, Brooks made a mention of how, there's in-home care, and then there's an institutional care like an assisted living, and then there's a nursing home, and then maybe there's a care home. There's all these different choices. How do we know which one to ask about even?
Well, I am a proponent for adult daycare, which is the most economical thing for someone that needs assistance during the day while their loved ones go to work, or do their own thing with friends and family. So there's like different rungs of the ladder. The first thing would be if they're still able to live at home, and they're somewhat functional. They don't have to be, they can be in a wheelchair, whatever. They can go to adult daycare, keep busy, keep socialized, keep active, which slows down the decline, actually. And then when they can no longer come to adult daycare, then they might think about in-home care. And then they might think after that about care homes or foster homes and then long-term care.
Where is adult daycare? And how do you know where it is, and how do you pay for it? Do you have to pay for it?
Okay, we have facilities on all the islands. Most of them here on Oahu, though. In the Caroline's group can give them the information on where to find. I'm the president of the Adult Day Centers of Hawaii, and I have the resources. I have all the names and numbers. So, and I put that on my website too. They can call and get the information about that too. But yeah, you have to pay for it. I'm a nonprofit organization, but I still have to pay the rent and pay my staff.
Because there's also like community centers, right? You'll see
Senior
this
center.
rec center. They have something. I mean, is there enough of that available that someone could use that as a step towards adult daycare, or is adult daycare quite an institutionalized system? I mean, institutionalized in a good way. I don't mean like an institution.
No, it's
I
not an
mean,
institution.
But it's a system that exists called adult daycare. When you ask about it, they're going to be referring you to a company.
Yeah, the senior centers are more for people that are still very independent
Right.
and don't have health issues. Well, they have health issues, but they don't have debilitating health issues.
Okay, that's the kind of distinction I'm hoping that we can make here, so that people kind of go, okay, when mom gets to X, this was the thing, and that was very helpful. Kaylee, you seem like you're anxious to throw
Oh,
something.
no, I mean, I think that's just the difference, right? So with the senior centers, they generally are people who are able to get there on their own. It's a wonderful opportunity, though, for folks to engage. Kathy talked a little bit about the term isolation, or the degree to which people engage. Isolation is one of the worst things for cognitive decline for anyone, really, but as people get older. So having that opportunity, even if they're cared for at home, if there are times where you're able to get them out to, whether it's adult daycare or to socialize with other family members, interacting with other individuals is very important for that.
Brooks, at some point with your mom, did you try that, or?
Absolutely, absolutely. We looked at the gamut, really, and I live on the windward side. We went to a place on the windward side. We visited it, and to kind of answer your question earlier about what the setup is. I mean, some of them will serve a lunch or something. If you take them there during the day, they'll serve a lunch, and there are common areas, there are televisions, there are big recliner chairs. People can take a nap, but it's still not your house, right? You might still not be as comfortable as you are at home. So aging at home is what we opted for, and that was bring someone in, 4 hours a day. I'd go in the morning, make breakfast, make sure there was some lunch. I'd go off to work. Someone would come for 4 hours in the middle of the day. Then I'd come home and take care of dinner and medication and stuff like that. And then, but there's a progression, right? And eventually, sleeping on the couch, keeping an eye on mom overnight, that doesn't become something you can do long term. You need some sleep to get up and go to work. So that's when you go residential. And then when you go residential, Daryl, there's all different levels, right? There's assisted living, there's memory care, there's someone who's bedridden. And so there are all these different levels, which come at different cost tiers.
Yeah, let me just
Exactly.
really quickly, I got a call from Ellen, who says, how important is continued social activity, which is right in the sweet spot of what we were talking about: card games, mahjong clubs, quilting, other crafts, garden clubs, etc. And then I have another caller who says, we need reliable transportation for Kapuna to use for doctor's appointments, run errands. We have Handy Van, we have all these other systems. Are those adequate? I mean, can you rely on that to get mom or dad to the social activity and maybe have some relief if you're trying to go to work?
So I'll jump in here. The first one is, it's very important to stay socially active. We've known through the pandemic how isolated older adults became, and we've seen, I think, the outcomes from that. And one thing we learned is to make sure that people stay socially connected. So thank you, Kaylee, for sharing that. As far as transportation, those are some of the services that we do provide. There is Handy Van, there's There's the transportation we provide through our service providers and publicly funded services and supports. There's also, we're starting to do new pilots. One thing we learned from the pandemic is to be a little more nimble in how we are addressing and developing programs. So there's a new program that's really just being pilot tested now. They're using Lyft and Uber, I believe, to actually provide for a very small segment of the population, but it's something that even our neighbor islands are now trying to look at and
Is
see
that
if
government funding the
Yes,
actual
yes.
rides? Because just a quick personal story, for my mom, the caregiver doesn't drive. She immigrated, hasn't got her license yet, but my sister set her up on Lyft, and she just says, anytime you need a Lyft, just use that account, and boom, you're there. And it's like $15, which is, it's way cheaper than a cab ride, you know. And I think that this is we started talking about this, and I think that now is when we should talk about it. Eric in Kailua asked, please talk about how important it is for families to plan for future care. These are conversations that need to happen. Knowledge matters. So let's start. Anyone can pitch in here. When do you have this conversation? I mean, because older people don't like this conversation, generally speaking. So how do you do that?
Yeah, absolutely. It really needs to start as soon as the earlier the better. You know, I don't think there's a time when it's too soon. Let's put it that way. You can have a situation where someone who you care for is very young and very capable, and something tragic happens, and all of a sudden they need care. So there's not really a point where you say, well, let's wait till you get, you know, mom has a hard time walking or whatever the case may be. The sooner the better, around what people are looking for and what's going to be ideal for them. But the other is, you know, Brooks talked about a little bit too, is the financial planning. For some, that's going to be the challenge. Luckily, again, in our case, my mom was able to age in her own home, and we were all the free labor. We probably would not have been able to afford to have her be able to be in a facility, but at the same time, in our case, she may not have lived for as long as she had, I don't think, for that. So
just really quickly, I got another caller on the same subject. You know, how do you start these difficult family conversations? Do you need a peg? You know, like, oh, Dad, it's time to give me your car keys and let's talk about this other stuff. You know, how do you grace that? I mean, Brooks, I'm wondering, did you feel like your conversations with your mom about this?
I got to tell you, I was really lucky. My mom was progressive. She was on top of this. She probably started talking about it as long ago
She brought it up.
as I can remember, 30 years ago. I mean, so she had the Advanced Health Care Directive. You know, we knew which way to go. We knew what her wishes were. So we were fortunate in that regard. But when someone has memory problems and they start suffering from dementia, that stuff slips. So you got to have it on paper. You got to have it written down. And you talked to Kaylee about, do it soon. Like, there's no real magical age.
Maybe right after this program.
I'll tell you, Daryl, as soon as my mother passed away, it was immediately in touch with an attorney. I want to make sure everything is set up for my wife. So, I'll be 62 in a few days and 72 if I'm lucky someday. And
I'm going to check your pulse.
we'll have to have Kathy do it.
Yeah.
Somebody trained.
Yeah.
Okay. Oh, go ahead.
Yeah, I'd like to add, though, that I think it's hard for families to have that conversation. I would tell maybe the viewers that are older, maybe they haven't started planning, open that conversation up with your children or your niece or nephew or whoever you feel comfortable with, who you trust, to have those conversations. And then I would also suggest that, educate yourself. There's a lot of presentations out there. There's things around planning. Listen to the presentations, get the information you need, and
you bring up a very good point, and I would like to ask Kathleen to visit on this, because it strikes me that if you, as the elderly person, bring it up, that's going to be such a relief to your children, because they've probably been terrified of the idea of bringing it up to you. And Kathleen, what needs to be part of that conversation? What needs to be included? You know, is there some things that are easy, and then we move to the next level of what's harder, and then the next level is harder? How would you handle that in a conversation or a process of conversation?
My personal experience was my folks said they never wanted to go to a nursing home.
But they say that, but does that?
Well,
What do they
and
mean?
that's when I became a nurse. Because I didn't want them to have to go to nursing home. But anyway, that's another story.
It's a good story, though. Thank you.
But they had everything planned out for us. We never even had to have the conversation because they were so organized. But I think I agree that like I should be having this conversation with my daughter. Okay, it's time to do that, and
You
I
haven't done it
that.
yet?
No, and I've been very remiss on paperwork as well, the advanced directives and stuff like that. So.
Wow. Well, if somebody in your position is in that, then maybe we shouldn't be embarrassed about ourselves.
Oh no, definitely don't. You know what is that whole thing where a cobbler's children go without shoes? But the other thing too is ARP actually has a caregiver checklist. It's so you go to arp.org and you search for caregiver resources. And it's a document that actually walks you through the types of things you want to prepare for and look at. There's one related to finances, and there's another one related to caregiving. So there is a lot of resources. The adult disability and resource centers are amazing. So you're talking about transportation earlier. For the neighbor islands, many of those providers or resources, or they have service providers who do that. The other thing I would say is, for those of you who are capable, there's organizations that can use volunteers to help them. I will go with Catholic Charities is starting up a program. They're looking for volunteer drivers to actually work with and help kupuna when they go to when they go to their appointments. So there's a lot of different ways, whether it's helping with Meals on Wheels. I mean, there's just really so much opportunity out there to give back and help kupuna. So that's the other thing I would want to reinforce, Daryl.
Go ahead, Kathleen.
AARP has so much stuff to look at. I mean, it's amazing what they have. But the problem we talked about earlier was, how do people find out about this? And I really think the catch-all would be to have a mini public service announcement on every TV station frequently, so that people know if you need help or if you're a caregiver in need, call this number.
It goes back to the one-stop shop question we had earlier.
Yeah, right.
You know. You know, when you start having these conversations, what are the things that most people don't talk about that they need to talk about? I mean, are there particular black holes in people's, you know, because I know finances are tough, because sometimes you're telling your elder, you know, you really didn't plan for retirement very well, and now we're kind of got a problem. You may not be able to keep your house, things like that. I mean, are there things, what are the hardest things to talk about, and any thoughts on how you approach it?
I would say probably death and dying. Like, what are your wishes? What do you want? How do you want to go? I think are probably the hardest conversations. I would say check out Kukua Mau, check out their website. I think they have a lot of resources on how to approach those types of conversations.
Yeah, and I would agree, that's the hardest. In our care for our mother, things were, well, I mean, sisters came when they could, you know, from Michigan or Hilo, and all of that went really well. As soon as Mom started clearly being at the point where she wasn't going to be with us for long, we almost fell apart. And the tensions and what could have been really life, you know, long divisions within our family all came around that final discussion. Even when you know what they want, everyone's personal issues are. So having folks like Kukua Mau, there are organizations that, whether it's hospice, services and such, that are used to these types of things and can help you talk through some of those issues. So I think the main thing for folks to realize is this is not something you have to do alone. There really are a lot more services. So one, you know, Daryl, thank you for doing this show. I mean, this is a way that people find out and learn. Is there's just a lot more visibility around the issues.
Any other issues that you think that really do need to be discussed? Now, when we talk about these different levels of care, we talk about nursing homes, we talk about assisted living and so on. Is that something that is part of that conversation, or does that just sort of take care of itself when you go step into the next step,
Well, that's part of your financial planning, I think. If you're going to start, and please remember to mention adult daycare.
We're about to mention it again. I got some more questions.
The financial planning for that part of it, because I mean, it's so expensive to be in the plazas is expensive. Everything, all of those types of places are very expensive. And unless you have a good financial plan or really good long-term care insurance that actually pays, it's going to be an issue for everybody, the whole family.
Yeah.
So the talk about money, is that a conversation about the kind of facilities people want to go in or can afford to go in?
Afford.
Can afford. It'll come down to what you can afford, and that's where the range. So there's what one calls adult residential care homes, which is very different from a nursing home, but the cost is different. And the other issues is whether Medicare and Medicaid services will reimburse for some of those things. There's a lot that goes into this. So the financial planning is important, but you're going to say something, Bruce.
Well, just the financial planning, we talked about, we jumped into this part of the conversation by talking about what is the most difficult thing to talk about, and the death and dying, that's difficult.
Financial is
but
too.
when you have a parent who is accepting of that and has prepared for it mentally and is actually ready for that, you know, in some ways kind of looking forward to maybe there's another adventure ahead.
Yes.
That made it easier because you as the child, you know, mom's okay with it, dad's okay with it. It's still incredibly difficult. I mean, it was tougher for us than for her,
Yep.
I'm sure. Yeah. But the financial end of it, it is not where you want to go, it is what you can afford, because it can be incredibly expensive. If you talk about moving into a really nice place, and then you maybe need to supplement some care on top of that by bringing some people in. Who has $25,000 a month that they can throw around? Like that, those are real figures, and none of us have that kind of disposable income.
You know, Kelly brought up the residential care homes versus the nursing homes and so on. I don't know who wants to bite on this, but can I get a quick synopsis of those choices and how they are financed and how much do they cost? My understanding from what I've seen of some care homes, my wife is Filipina, and so I'm familiar with the Filipino community. There is a comfort level there with, nobody likes it particularly, but there's many care homes. And what I understand is they just take what you got a lot of times. I mean, is that a fair assumption, or how does that, are those more expensive than a nice assisted living facility?
No, they're not more expensive, and it'd be great if they did take what you can afford, but that's not always the case. So they're regulated. Again, there's unlicensed adult residential care homes, and there's licensed ones, and they're required to have only a certain number of people that they take in. And with adult residential care home residents, they still are pretty independent. Right? They still might need some oversight and care, but there isn't what one calls acute care, which is where you really need people who have medical skills to actually help care for that person. So that's part of that range of the different services. And again, at home is always, I believe, best.
It is, and that's what our programs really promote and support is aging in place. And if you scanned a room, the majority are going to say they want to stay at home. So how do we support that with the development of programs and policy around that to make sure that they can age in place?
Yeah, so we've been talking about nursing facilities and adult residential care homes. The other thing is what they call home and community-based services. So Brooke mentioned having people come into your home. That's the other spectrum of services that are out there where you're able to have CNAs or someone who helps come bathe your loved one, maybe helps come provide the meals during a certain period of time. So that's part of the other issue is, and the challenge is, Daryl, is there's not enough. There really is not enough. We have heard from folks who maybe can afford, if not necessarily a nursing home or assisted living, they're like, well, I'm happy to pay for someone to come into my home and help care for my loved one, but the workforce isn't there. You know, so I don't want to get, that's a whole nother show.
No, I mean, but it's fair, because what that means is, when it happens to my family, okay, this is what we're going to do. Oh, really? Oh, no. You mean when? I mean, is there a wait? So that again goes back to the conversation. How do you plan for that?
That's a tough question, because the workforce issue is such a huge issue, and it's not just in our network and the work that we do. It's systemic across different disciplines, but I think, and that's where I think we're working together. We're trying to develop a long-term care plan that can address the needs over the next few years, and we've made new partnerships. We're working with Department of Labor and Industrial Relations to really look at that workforce issue. That's not my area of expertise, workforce issues.
I'm getting back. I'm going to go back. I'm going to circle back again, because you asked me to talk again about daycare, because I just did get a call from North Kohala. I'm wondering why elderly activities hasn't been mentioned yet. It's a huge resource on the Big Island, but we need more support. It's Margot from North Kohala. Is that the same thing? Elderly activities? Is that another code word for daycare? Or
Well, it also sounds like senior centers for them. Yeah.
Actually, I think because the County of Hawaii does have a very strong recreational component in their county. Well, all 4 counties do, but I think that's what the person from Kohala is talking about. And I think coming out of the pandemic, they're restarting a lot of those programs. And so I think that's probably, and I do want to say that, and I did say it earlier, if you can keep yourself healthy and well on the spectrum when you're looking at the whole continuum of care, the need for all those other heavier, more expensive services will be a lot less if you keep yourself healthy on this end.
And
Okay,
active,
so-
yeah.
oh, go ahead, Kathleen.
Healthy and active.
Healthy and active.
Healthy and active, yeah. So I have a big pile of very difficult questions. Sal, I thought I could care for my mom near the end of her life. I said I could do this. I was wrong. It took but 2 days, nights of about 18 hours per day, and I was already starting to get physically sick. Find the help you need and be willing to accept help. Please talk more about the family dynamics of caregiving, the time it takes, the commitment, managing emotions. Money is obviously a key element, but the mental strain and shared assistance matter as well. Manny, what advice would you give to a family caregiver who is drained mentally and physically? Many families can't afford other options, but the longer it goes on, the more draining it becomes. I'm getting really depressed. And I don't mean to joke about that, but it's like, many times we think we can handle caring for our parents and grandparents, but learn fairly quickly how challenging it is. It's physically demanding, and then add in the drain on your emotions. Caregiving is a full-time job, not as easy as you think. Brooks, I know that you are totally triggering on that.
Thank you to my wife and my sister for supporting me, because that helps you. Like even if the sister's not there, she's a hospice nurse, so I lucked out with that, right? She goes through this. She's familiar with it. So having that support, having my boss support me, I'm going to be away from the office, but everyone is. Everyone is going to or has gone through this at some point, so people can relate. And so be open and honest and talk about it. And I hope you can be as fortunate as I was to have people who will support you and understand why you're not always there, because you are helping somebody else, and understand the prioritization. I want to give you credit, Brooks, because you and our conversation was what prompted let's talk about this show. But also culturally, we have a lot of different cultures that have to deal with this differently, who will deal with this differently. I mean, the cultural component, I can't tell a family that is not from my culture how they should act. How do we message to folks that aren't like us?
Well, I think the thing to keep in mind is first of all, it's also very difficult for many of our kupuna to no longer be independent, right? So being sensitive to the fact that you're having to care for them is the last thing they probably ever wanted. So again, having that conversation early on, but being sensitive to that issue. The issue is, don't take it on alone. I don't think there's a single person in this world who can care for a loved one on their own. And the other thing that life experience doesn't prepare us for is caring for an adult or a parent. Very different than raising your own children and what you...
And when you become the parent and they become the child, oh my
Right.
gosh.
I mean, where maybe you may have put your children in timeout, when you're frustrated, you have to put yourself in timeout. You know,
you
so I
can't
think
put mom in
having,
timeout.
making yourself available to the resources out there. Again, I would plug the adult and disabled resource centers around, whether it's the conversations, but not, and also don't feel like you're the only one. And why I say that is, if we're not at our best, we're probably less patient, less loving than we know we want to be. So getting help, you know, if you've got a network, you know, feel fine with other people having, I like to, if I could get people to see caring for other people as a great privilege and a wonderful experience, don't hog it. Don't hog it to yourself, you know. Reach out to, whether it's a family member, extended family, neighbors, church members, get help. I will plug adult daycare and or other programs where we talk about what in our industry, respite care. Getting time to yourself to just get away. Sometimes we'll have events where it's like, you know what, caregivers, get someone to take care of your loved one. We're gonna have this fun opportunity for you to come, get away for a little while, and take care of yourself.
Kathleen and Caroline, can you guys weigh in on that? I want to go back to so many questions about coping.
And those examples that you were reading, it hits home because I'm also a caregiver, and you've been in that situation too, and it is difficult. And I would say, yeah, don't try to hold it all in or try to do it yourself. If you have family or friends, and I know there are some that don't have family or friends, then reach out and find out if there are any publicly funded services and supports. If you belong to any church groups or something like that, sometimes they're willing to come in and actually stay with your loved one. And it's so important, I'm so glad you brought it up, that caregivers have to have that break. They will break themselves, and they're no good for their loved one if they're not whole. So I think they really need to get that respite.
Statistics show that I don't know if it's 50% of caregivers pass before the people they're taking care of because of the stress. But the thing is, the people, those messages that you read about the people that are struggling, there are caregiver support groups all over the place. There are virtual caregiver support groups, so you don't have to leave your house. There are in-person care groups. And that's so important because you're talking to people that are going through the same thing you're going through. And then you know you're not alone because you hear the same story. I mean, people, you're crying and you're laughing and you're sharing all these experiences, and it's so cathartic because you know you're not alone.
Tell me again who that is and
What?
how you access it.
Caregiver support groups? Well, I have a virtual caregiver support group.
Just
Caregiver.
Google it? I mean, how do you find
Well, no, you'd have to email me.
AARP does. AARP has, in this case, it's a Facebook group, and it's the AARP Caregiver Discussion Group. And it's facilitated by our AARP's family caregiver expert, Amy Goyer. And what people have is that opportunity to say, here's what I'm doing, I'm struggling with this. You know, I went to seminars where I was able to find out a lot of things that really helped me learn from other people on how to do certain things. I mean, you know, mom not wanting to eat certain foods, or, you know, how to actually, get her to feed herself. And yes, it's a little bit messy, but let her have that independence. I mean, just different things like that. The other thing I want to double back though on, Daryl, is the doing it alone. I've heard people say, I don't want to burden my children with helping care for their grandparents. And I'm like, again, when I talk about don't hog it all, so if you have children or grandchildren, do not say to yourself, oh, it's a burden for them to come help take care of Tutu or whoever. It's a privilege, and it gives you a break, and it's a skill, regrettably, we're all going to need to learn. If there were such a thing as caregiver literacy, that's the thing. At some point, all of us are going to be caring for a loved one.
Ed Brooks.
The support, friends, their friends, my mother's friends, because they not only gave me support, but they engaged with her, they kept her going, they kept her thinking, and as we've already talked about, when you're active, when you're doing cognitive things, you're not just sitting there watching, TV all day long. We love TV, Daryl, but not all day long.
I don't watch a lot.
I know, but so the friends were terrific, and I think that's an important thing. And I haven't said this yet, and I promised myself I would say this sometime tonight. But a big mahalo to these professional caregivers who we had coming into the home at some point. A lot of these were professional, either medical students or headed in that direction, and they were hired by, they were employed by these various groups that bring people into your home, $35-40 an hour. It is money well spent because it gave you time away, and they were all fantastic. And then when we got to the residential level, these people are doing incredibly difficult jobs that I would not want to do over the long haul, and they are doing it with love and care and attention. And so a big thank you to them because they were wonderful. They're a lifeline.
Right.
Another thing is, for the caregivers that were struggling and everything, you've got to build a team to help you. You need to be assertive.
Before there's a crisis.
Well, yeah, and ask for help. Ask your neighbor to just come over for an hour so you can just take a nap. Or ask your cousin to come over for 2 hours and let me go to a movie. Just ask for help. Don't just sit there and say, I've got to do this all by myself. I got to, ask.
I got a number of questions. I appreciate how everybody is responding to this show. It's quite touching. Viewer is 78 years old and lives alone with several healthcare problems, including 4 surgeries. Suddenly served. I'm not going to summarize all this because I don't want to identify this person, but basically they're facing foreclosure. They don't know what to do. Social Security check's not big enough to pay the bills. Is there someone who can help me? I mean,
Possibly Legal Aid Society?
Legal
Would that
aid,
be-
but I would say legal aid, absolutely, they should contact legal aid. And because, in fact, legal aid, that's one of the things that they do for seniors and have a program specifically for those types of issues. And also finding out whether there are programs out there that the state has. So state has rental assistance programs, different types of programs that might help people. And I think where legal aid might be able to help that person, especially if you have some assets, is how to maybe take that equity and have to regrettably maybe move into an
so
adult
legal aid
residential care.
might help people with that kind of a thought process too, as opposed to the trust lawyers that are advertising all the time about how to do this or that. Like legal aid might help people with that income.
If they have their own income challenge, I mean, clearly, if you can afford to pay an attorney,
Right.
legal aid's not your
Yeah,
place to go because they're helping people who can't afford it on their own.
Okay, I got 2 questions here again, and the pattern is striking. What about individuals who have no living relatives? And there are some, many. What about seniors who don't have family here in the islands to help them? A lot of people in Hawaii are in that situation. We went through that with our neighbor, and it took a while. Her family ended up coming over finally to sort of rescue her. But what about that? What do we do for those folks?
There's organizations that help. I have the Caregiver Foundation is another a group that has a lot of caregiving support groups too. But the Caregiver Foundation helps people specifically that are alone and have no family.
The Caregiver Foundation. And that's something they can Google?
They can Google that.
And I guess if you have a neighbor, I didn't know that about when our neighbor had a problem. We basically helped until the family got here, right? Because we liked the neighbor. But I mean, the knowing about that would have been very helpful.
Yeah.
We've said a couple times, it's something you can Google, because we all Google. Like, we Google all day long, right? That's how we find stuff.
But older people don't Google. so
Well,
much.
that is something I found, that the technology, there's, whoa, what's this? Anything new, especially as the memory starts going, that phone that I knew how to use last week is a challenge today. That microwave is just impossible. And Google, it could be a challenge.
My brother put into my mom's house an Alexa.
Oh,
Is there technology that can help, that is easy and accessible, that you folks would suggest?
I do. I know that there's a lot of telemedicine and a lot of movement towards that, especially for those living alone, or for those that maybe their family's far away and they're alone, and they have the ability to actually, it's almost like a nanny cam. But I think the loved one has to be comfortable with it, for one. But I think that those are technologies that could be used in the future, and I know there's been a lot of discussion around that. Maybe Kathy, I don't know if you have.
well, I just heard about this really exciting thing. It's a tablet, and you program it with your voice, and it's got a motion detector on it.
Oh.
So you program it, and mom gets up in the middle of the night, and the motion detector knows that, and the voice goes off and says, "Mom, it's the middle of the night. You need to go back to bed."
Yeah.
Or you've got it in the afternoon. You program it. Says, "Mom, it's time to take your green pill." Or, "Mom, it's time to eat lunch." Just something like that. I think that's exciting.
That is fun. Yeah. So we're just getting a flow of stuff, and some of it's very helpful. The Hawaii Home Share Program is a nonprofit that can help place kupuna with younger members of the community at no cost to seniors. Steve from Manoa, what's that?
Yep, it's a program where, so that gentleman that maybe is
Hawaii
challenged-
Home Share Program.
Yep, Hawaii Home Share Program. They will actually vet the participants. And so if you have your home and you need care, you can have someone else move in with you, and who's vetted, who you and they can work together on what ways to have you be able to stay at home. They might not be literally a care provider, or they could be. Again, as we know, one of the most difficult things for many folks is finding somewhere affordable to live. So a program like that makes it really ideal to kind of get people networked.
I'm going to read a couple of things that are going to reaffirm what we've already talked about. When my mother was bedridden, I arranged for her friends to come spend time with her. Not everyone could, but some did. The spark of life during those few hours of those visits was precious. Friends want to be involved, just ask them. That's from Jerry. I would like to give a shout out to the Handy Van. They are really a lifesaver. I wouldn't survive without it. Elizabeth from Diamond Head. One of the things, though, that I want to make sure that we cover is for people who don't have money. Where do they start out? Like when the kids are barely getting by, they've got their own kids, maybe they have a house, maybe they don't. What are the resources for people who are not able to pay really for almost anything?
Right. And living day paycheck, or living from the
Social
Social
Security.
Security as a Social Security,
Right.
not paycheck, Social Security. We do have a lot in the workforce still that are aging. I would say to really, that's what we're grappling with. That's where publicly funded services and supports can come in. And that's why it's important to, when you're in need, to call the Aging and Disability Resource Center, because they can, when we're talking with the individual, we're going to find out, do you have the ability, or we don't dive into finances.
Who are they going to be talking to when they call that number?
Our aging, we call them ADRC specialists, Aging and Disability
Is it a government
Resource
worker? Or
Yes,
is it-
so
is it a
at the
social-
county level, so they're within the city and county of Honolulu and our neighbor islands.
Are
But
there plenty of them? Will they answer the phone right away, or do you got to leave a message, have them call
they
you
may
back?
have to leave a message, and we do get back. They can put a referral through online if this is, a family member or a caregiver. But I really think, especially for our live-alones and for those that maybe don't have family, that's a good place to start.
Another one that I just thought about is 211.
Oh, that's another great
United
one.
Way has their 211 service, and that was extremely helpful during the pandemic. They as
They really ramped it up during the pandemic.
yes, Aloha United Way as a network. I mean, a network of agencies. Their 211 program is specifically for the purpose of providing people information of who to connect with and who to contact. The other thing would be the Department of Human Services. You know, a lot of kupuna, especially if your Social Security is not enough. I hope the statistic has changed, but there was a point where the data showed that only 50% of kupuna who are eligible for SNAP benefits were actually utilizing
That's what
those
used to call
benefits.
food stamps.
Yeah, it used to be food stamps. So, and my thing is that's absolutely something they should avail themselves of. So again, it's not being afraid, and it's looking at what those options are, and not being afraid to ask for help. Because just as we're talking about the caregiver not wanting to ask for help, the person you want to care for is likely not going to be someone actively seeking support. The thing is, don't do it alone. You know, whether you're an individual trying to stay at home and make sure you're able to remain in your home, don't do it alone.
I would,
go ahead.
so sorry, circle
no,
back
please.
to what Kelly was saying, that especially for those live-alones and those that are by themselves, is do you have a trusted friend? Do you have some social connection with someone? They may be a resource to start there too. And then maybe together you can kind of go down that journey.
I got a quick confirmation of what we've been talking about. I agree with the notion that grandkids should be part of the help. If nothing else, it furthers the family bond and prepares them for the help they may need to provide for their parents later on. That's from Paul. A couple of questions, though, about the subject you just brought up is financing it. You know, are there enough people going into the caregiving industry? Does it pay well enough to attract people? This is a societal thing. How do we create awareness? That's Kibo on Maui. Family caregivers are not paid, and that is a big issue. Is there a resource to give family members who stop working to take care of a family member some money?
There are programs that folks are wanting to have happen. So I'll say for us in Hawaii, our members of Congress are working actively to try to get reimbursement. So some of the challenges for these facilities is they too rely on government subsidies to be able to help cover the cost of what it costs in a facility to care for someone. Hawaii and Alaska, for some reason, don't get reimbursed at the same way the rest of the country does. So our delegation is working to try to get Congress to agree to deal with either reimbursement issues, COLA issues that Hawaii isn't getting. So I guess that's the challenge, is there's so many pieces that fit into that. The other issue really is passing legislation, getting legislation. There's actually a program. So one of the things, for example, with the adult daycare, there's the Kupuna Care program, where in fact funds are made available to help a family member get reimbursed or cover the cost for a loved one to be in family daycare for a little bit.
Caroline, tell me the name of where they should call again and give me that phone number.
It's the Aging and Disability Resource Center, and the phone number is 808-643-2372. And that number is for the whole state.
And we have it on the screen. Good job. Hey, Brooks, we've only got about a minute left. From all of this that you've just heard today, how helpful do you think this would have been if you'd watched this show 15 years ago?
I would watch it again on Sunday for the replay. I would find it online. I would be sitting there with a pen and paper. I would write down some of the phone numbers. I'd write down some of the names of the organizations. I'd call Kaylee. I'd call Kathleen. I'd call Caroline. You know, prepare, and practice patience, because when you're going to become that caregiver, boy, that word patience, you know, you talked about when you're going to have to put yourself in timeout, you are going to have to do that, because that's your mom and she's still the boss.
Exactly.
Yes.
So be patient, learn to be patient, and if you can, prepare yourself financially, but it's so tough.
Yeah, I mean, it's a very intimidating thing to think about how much money it's going to cost, but it sounds like if you prepare, you can find a way. And I want to thank you folks and all of you for joining us tonight. We want to thank our guests, especially Caroline Katarau from the State Executive Office on Aging and Kathleen Wyatt of the Hawaii Family Caregiver Coalition, Kayla E. Lopez, Director of the AARP Hawaii, and family caregiver Brooks Bear. Thanks all of you guys very much. Next week on Insights, it's one of the biggest decisions on homelessness in decades. Earlier this summer, the Supreme Court ruled that people can be arrested and fined for sleeping in public spaces. What this means for Hawaii and its homeless enforcement efforts. Please join us then. I'm Daryl Huff for Insights on PBS Hawaii. Aloha.
Local broadcasts of Insights on PBS Hawaii are made possible by the support of viewers like you. Mahalo, and by Carl Smith Ball, providing legal services throughout Hawaii and the Pacific since 1857, making a positive difference in the communities where we live.